All right, and we're live. Good morning, good afternoon, good evening, depending on where and where you are when you're watching this live. This is the voice and the face of Dr. Olabintan, CEO, founder of Livingspring Family Medical Center, right here in the good city of Mansfield, Texas, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. If you're watching this live, please hashtag live. If you're watching this on replay, hashtag replay. And I'm very excited to have with us the one and only Dr. Regina, who's a nephrologist, and will be talking with us on the topic, Doc, I have chronic kidney disease. What does that mean? Thank you so much for coming, Dr. Regina. I appreciate the time. I know you're busy, so thank you so much for coming.
Good morning, Dr. Olabintan. Thanks so much for having me on this morning. It's a pleasure to be here. Great question. Chronic kidney disease, what does it mean? What does it entail? How is it going to change my life if it does? And so I look forward to discussing with you this morning.
Awesome. Thank you. Now, I know I already introduced you as far as your name, but could you introduce yourself and what do you do? Can you explain it for our viewers?
Happy to. So my name is Regina. I'm a general clinical nephrologist with Dallas Nephrology Associates, which is a well-established group, a large group in the Dallas-Fort Worth Metroplex. I'm a Texas native originally. I've had the great opportunity to do all of my college, medical school, residency, fellowship, all within my home state, which a lot of doctors and other medical professionals don't have the opportunity. They travel a bit, as we all do. But I've had the opportunity to do all of that within Texas, which it's been great. And so I see patients with kidney disease in its various forms, whether that is acute, something is going on more quickly, sometimes in the hospital. I also see patients with chronic kidney disease, which is a condition which is more clinic-based and requires follow-up and monitoring. It's more like a checkup type of situation where we have to keep it on that several times a year. And I see patients who take dialysis, which is a form of kidney replacement treatment, whether that is a treatment that they're doing in the clinic, at dialysis clinic several times a week, or whether that is a type of treatment that they're doing at home while they're sleeping or in their home environment with one of our home therapy centers, as well as preparing patients for transplant. I refer my patients in the clinic and who are on dialysis to prepare for kidney transplantation in order to treat their kidney disease in that way.
Awesome. Now I was going to ask you, because I always like to ask my my guests, why did you decide to be a kidney doctor? What was it about the kidney?
Great question. There's not a lot of exposure, I think, earlier in the medical training at many places to nephrology and kidney disease as a medical specialty. And so it can be a little bit abstract at times, but I did get exposed to it in medical school. We see dialysis patients in the hospital, and as we all do, no matter what our specialty is. The hospital is a place where sometimes we see patients with kidney disease and who take dialysis. And at one point in my clinical skills class in medical school, we had the opportunity to speak with a patient who was doing peritoneal dialysis, which is one of those home therapies that people can do at home, such as while they're sleeping or during the daytime, when they do their treatments at home and then disconnect from the machine intermittently and go about their day. And what I was so impressed about with this elderly gentleman who was doing very well and thriving while he was taking his peritoneal dialysis treatment was that he still lived a very active lifestyle and was thriving with kidney disease. He still liked to travel, and patients who do peritoneal dialysis, as we learned, can still travel on airplanes. They can still travel on cruises. They can go on vacation with their families. He still worked part-time and was able to incorporate a work schedule into his dialysis treatment. And he still took a lot of care of his grandkids. And so he was, he was not having a lot of changes to his life in the sense of the disruption of the activities that he did and the things that the people that he saw and the places that he went. He was still very active. And he was thriving with kidney disease, not suffering from it. And so that was just very uplifting. And that's what I aim to bring to my patients is how can we fit your medical needs into your active life so that you can do the things that still make you happy.
I like that. You saw what was possible and you thought you could replicate that.
There's a lot of opportunities for a positive impact in helping people. And that fills my cup. That helps me feel good.
Awesome. Awesome. So my next question to you is this. In simple terms, Doc, for those who are watching, what is chronic kidney disease or CKD?
Chronic kidney disease means that the kidney function is lower than it was originally. It's a disease that does not really refer to what's causing the kidney function to be low, but means that the kidney function is lower and we need to monitor it. A lot of kidney disease and most kidney disease is due to systemic diseases like hypertension or high blood pressure or diabetes of both types, type 1 diabetes or type 2 diabetes. And in certain cases can be primary kidney disease that's not related to an underlying disorder, but those are a bit more rare. In most of these disorders, the kidney tissue can be replaced by scar tissue and fibrosis, where the natural tissue of the kidney becomes non-functional because of the scarring that is there. And what that means for patients who have this condition is that certain strategies need to be followed in order to minimize progression and to preserve the kidney function for as long as possible in order to prevent completely or to delay the need for any type of dialysis or the need for kidney transplantation in order to replace the kidney function once it's extremely low or has been lost. The main strategy we emphasize to treat kidney disease is to take care of your heart. What's good for your heart is good for your kidneys. And so we tell our patients that we all need to heart our kidneys, okay? So the main factors that cause kidney disease are the factors that cause cardiovascular disease and cerebrovascular disease, which cause risk of heart attacks and strokes. So the strategies are not different than what many of your patients are already doing to take good care of themselves and to stay healthy. And so it means taking good care of high blood pressure if someone has that condition. It means taking good care of the diabetes if the diabetes is the cause, and avoiding heavy use of over-the-counter anti-inflammatory medications that are not supervised by a doctor or a provider. In some cases, those can be needed for certain conditions, but when they're being used unsupervised over-the-counter, we want to spare those when patients have a diagnosis of chronic kidney disease as much as possible, because they can irritate the kidneys and overuse it.
Worse.
And so the best thing that we can do when someone is known to have chronic kidney disease is to see your primary doctor frequently. Have regular lab work done. Make sure the kidney function and the protein leaks in the urine, if those are present, are being monitored for any worsening. And so that we can institute strategies to minimize that and to prevent the progression of kidney disease and make the kidneys last as long as possible naturally.
Okay, awesome. Sorry, I froze for a second there, internet. But you already answered some of the questions I was going to ask ahead, but I wanted us to talk about the stages of chronic kidney diseases. Real quickly, what are the stages of chronic kidney disease?
We do divide chronic kidney disease into stages, which help us mentally organize what needs to be done at a particular time. Stage 2 chronic kidney disease is very early. And the most important thing in stage 2 disease is to be aware of it and to take good care of the high blood pressure and take good care of the diabetes. Stage 3 is still early to moderate chronic kidney disease or chronically low kidney function. And that involves continued monitoring mostly, but it also involves, if the patient is not already receiving certain medications to stabilize the kidney function, such as an ACE inhibitor or other classes of medications to preserve the kidney function and treat high blood pressure and diabetes. That is the time when we begin following strategies to preserve the kidney function for as long as we can to delay or prevent the need for dialysis.
Right.
Once a patient has progressed to stage 4 chronic kidney disease, this is the planning stage where there's not a need for dialysis yet, but there is a need to plan for the future, for what the particular mode of treatment will be in the future. We have options in treating kidney disease, whether that's with a form of dialysis, whether that's a clinic-based therapy or a home-based therapy that can be done in the home, wherever the patient lives. Also applying for a kidney transplant through a transplant center, usually a regional hospital, in order to be eligible for that. And that includes both being on a waiting list for a kidney transplant when one becomes available from a deceased donor, or to receive a living donation from a very close friend or family member who has already been tested and been confirmed to be a match for them, and to be at low risk of complications themselves and to be safe to be a donor, because that's what we want for everyone, is safety through that process. Stage 5 is involving implementation of the plan for dialysis. And so not all of my patients with stage 5 are immediately placed on dialysis once they enter that stage, but we have to watch a bit more closely, such as every 1 to 2 months, to make sure that we are prepared adequately for dialysis and to begin it once it's necessary to avoid the complications and the symptoms of end-stage kidney failure. And so that is the stage where we start dialysis when it becomes needed.
All right, awesome. I want to ask the next question before the internet disappoints me again. Now, is it possible to reverse it? So have you seen people go from 5 to 4 to 3 to 2? Is it possible to reverse it?
Kidney disease is not most commonly reversible. There are causes of acute kidney disease which can be reversible, such as simple dehydration. When someone's drinking enough water in the hot Texas summer, like is often the case down here, or during acute kidney syndromes, such as acute lupus, when it involves the kidneys, or acute vasculitis when there is diagnosed. Chronic kidney disease refers to the replacement of kidney tissue with scar tissue, which does not grow back and regenerate, unfortunately. There's research into that area, but that is not a possibility currently, although we all hope for that in the future. What is the most important is routine monitoring, routine lab work, close follow-up with the primary doctor, close follow-up with the kidney specialist when that is appropriate in the later stages of disease, and doing everything we can to hold on to and preserve the kidney function naturally with protective medications, with blood pressure medications, with healthy lifestyle, and planning for the future when that's needed.
Awesome. So you dropped a lot of gems here as far as ways to protect your kidneys. You talked about the kidney scarring and how that's hard to reverse. And so the best way would be to prevent progression, right, from CKD1 to 5. And you mentioned some of them. You mentioned hydration as something that's very important for your kidneys. Granted, of course, these are medical suggestions. Of course, you should see your primary care doctor, see your own specialist. a plan unique to you. Of course, some patients who have heart issues shouldn't drink too much water, but for the vast majority, hydration is important. Avoiding things like over-the-counter medicine, NSAIDs, your ibuprofens, your Motrins, using them a little bit too much can also affect the kidneys. And you mentioned something earlier in the show. Protect your heart. The same things that protect your heart help preserve your kidneys. So I wanted to re-highlight those because those preventive measures are very, 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 very important. Now, my last question to you is this. People are wondering, like, wow, doc, this is a lot of useful information. This has been very, very good, very, very useful. Where can people connect with you, doc?
Wonderful. And I love seeing patients and talking about this more in the office because this is 100% of what I do is take care of patients with a kidney problem. I am with Dallas Nephrology Associates, which has been established since 1971 in the greater Dallas area, and now is over 25 areas in the Dallas-Fort Worth Metroplex. I see patients in the DeSoto area and our office near Methodist Charlton. And I also go to our office locations at Baylor, Waxahachie, and Methodist Midlothian. We're also online, and you can see our social media accounts there. There's some great tips there, as well as some recipes for patients with high blood pressure, diabetes, and chronic kidney disease. So if you want to see what's still possible in the kitchen when you're living well with kidney disease, I encourage you to tune into one of those social medias. And we have a YouTube channel, and so some of our doctors have their web interviews on the YouTube channel. So if you want to meet some of our doctors, maybe before coming to one of your appointments, I encourage you to go on there and just see how inspirational some of our doctors are and how much we all want to help.
Awesome, including yourself, Dr. Regina. Thank you so much for coming. This has been very useful. And for those who are watching, please share. Those who watch this live, watch this little replay. I like the fact that you have even culinary options for those who have kidney disease, because how you eat also affects your kidneys. So that's very, very, very important. So thank you so much for sharing that. Let me take this off the screen. And I'll be sure to also put it in the comments too for those who want to kind of just click and go as an option for them. Okay. So thank you so much for coming. Thank you for those who are watching. Sorry, I can't tell who's watching right now, but big shout out to you. Thank you for joining us. With that being said, it's been a pleasure. And if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician here in the Mansfield, Texas area, I am she. Thank you so much. Thanks, Doc.
Great day. Thanks for having me.
My pleasure.